Hi everyone. So welcome back to Tuesday Reading Live. This is me Vandana PS joining you from Neetu's Academy. Okay, so shall we do a sample question from part B? Are you guys ready? Okay, I'll give you a few seconds to join this live segment. I'll wait. Let me know how many of you have joined. All right. Okay, I'll give you, as usual, 2 minutes for doing this particular question. Then we will discuss the answers. So here comes the question. Yes, so welcome back once again. Good afternoon, everyone. Okay, Joshna, Varsha, Lijo, Jisa, Star, Delita, Mithun, Shiny, Abina, Sony, Reshma, Sobi, Sankita, Asha. Good afternoon, everyone. Okay, so what about this question? I'll read this question, then let's discuss about part B. Okay, this into this question, the standard explains that in case of living donors. Okay, so what are the keywords from the question? And the thing that I've noticed, there is no mentioning about which category of question is this. So any idea, anyone? What category of question is this? Hi, Anu Thomas, good afternoon. Okay, so what category of question is this? Any idea? In which category the question falls under? The standard explains that in case of living donors. Okay, so my keywords, standard, then explains, as well as living donors. So these are my keywords from the question. Okay, so which category? Let me know in the comment box. Okay, Bindu, this is an email. So why this is an email? Why this is an email? Yes, hi Mithun, good afternoon. So why this is an email? Any idea? Yes. Okay, so this is all about, I'll read it, then we will discuss in which category the question falls under, okay? So option A, when you read a question, always connect with your option. So the standard explains that in case of living donors, a collection can only take place once their history has been taken. So my keywords, collection, only, then history. Okay, and option B, the standard explains that in case of living donors, a therapeutic goods order supersedes all other collection requirements. So that therapeutic supersedes requirements. And from option B, interviews must outline everything that occurred at least 1 month prior to collection. So my keywords, interview, must, then 1 month. Okay, so these are my keywords from these three options. Okay, so now I am moving to this particular paragraph, requirements in relation to the medical and social history of prospective donors. Okay, and in case of a living donor, the blood components, cells or tissues must only be collected from a living donor with whom an interview to obtain the donor's medical and social history has been conducted and recorded in accordance with the following requirements. See? Okay, so already they have given some requirements here, some kind of words which indicate it is a guideline. Okay, so we can say that this is a guideline because it's all about the requirements, some instructions what they have to follow before taking or before receiving these type of components like blood components and cells or tissues from a living donor. So what are the requirements? What are the instructions that you have to follow? So that is all about the guideline. Okay, so I can say this question comes under guideline, the first category. So what are guidelines? Once again, it is all about a particular procedure, not a procedure, yeah. It's all about a lot of instructions as well as principle, a set of principles or instructions that someone has to follow. So here it's all about what you should understand, what you should follow if you want to collect these type of components from a living donor. Okay, so that means this comes under the first category, which are guidelines. Okay, then what are you reading for in a guideline? Yes, Reshma, we are very good dear. It is a guideline. Hi Divi, good afternoon. Yes, Roshna, good afternoon. Sankita. Okay, so, okay Sankita, dear, it's not a notice, it's all about a guideline. Okay, so because it's all about some requirements mentioned, the instructions which they have to follow, right? Okay, so if it is a guideline, then what are you reading for in a guideline? We are reading for the details, to understand the details here. Okay, so so what are the requirements? The first one, the interview must be is a particular word that indicates it is a requirement or something that you should follow. So the interview must be conducted with the donor or guardian next of kin by the trained interviewer and should be a face-to-face interview Then the second requirement is that the interview must be conducted no more than 30 days prior or 30 days after the collection of the blood components, cells or tissues, and must occur prior to any release of the relevant product from quarantine unless otherwise specified in another current therapeutic goods order that applies to the relevant product. Okay, so that's all about the paragraph. Okay, so let me know in the comment box which is your answer. Okay, Reshma, detail and first sentence is important. Excellent, dear. Very good. So if it is a guideline, the first sentence is always important. Okay? Yeah. So any idea which is the correct answer here? Which option is correct? Okay. Okay, Roshna, we are reading for the details. Yes, Bindu, we are reading for the details. Yes, Jessica. Hi, Jessica. Okay, Sankita, Reshma. Okay, Benny, it is details. Very good, dear. So what is the correct answer here? It is a little bit confusing, I know that. But still, what is your answer? Yes, Star Delita, it's guidelines, okay. So let me know your answer, please. Whether it is option A, B or C. Okay. Okay, Reshma. Okay, yes, Star, it is first sentence is important. Okay, Bindu. Okay. Okay, Reshma, Chaco, okay. Any other answers? So majority of you have said it's option A, right? Okay, Litty, it's option A. So how can you eliminate option B and C? So the method we are following here, it's elimination method, right? So how can you eliminate B and C? Nammal engane eliminate B and C? We should eliminate something, right? So how can you eliminate the other options? Okay, so B, A, eliminate because history can take before or after. Okay. All right. So that you will eliminate option A, right? Collection can only take place once their history has been taken. So you will eliminate option A because history can take before or after, right? Okay. Then what is your answer? Is it option B or C? Okay, Linu. Yes, Anu. So majority it's A. Let's see. So collection can only take place once their history has been taken. So what about the first sentence here? Okay, in case of a living donor, we are collecting these requirements, I mean this blood and blood components from a living donor. So in case of a living donor, the blood components, cells or tissues must only be collected. Only be collected, which means what? From a living donor with whom an interview to obtain the donor's medical and social history. These two details collect you can go for the collection. Okay, so in case of a living donor, that is what is mentioned in the first para. In the case of a living donor, if the patient is a living patient, a donor, the blood components, cells or tissues must only be. So which means it is compulsory. You should collect it only after conducting an interview and then collect the details about their medical and social history. Okay, then you can collect these things. Okay, so that is in the first para. So how can we eliminate option A? We can't eliminate option A because collection can only take place exactly the first paragraph. Okay. Then what about second option? A therapeutic goods order supersedes all other collection requirements. So what about that one? It is mentioned somewhere in the paragraph. I noticed that. Therapeutic goods order. So what about that one? Therapeutic goods order supersedes all other collection requirements. So is it the first one supersedes, which means which will be the primary? Okay, the initial one. Okay, so is that all about therapeutic goods order? No. Okay, it's not therapeutic goods order. The first requirement is you should conduct an interview with this donor. Okay, so that you can eliminate option B. It is contradictory option or opposite option. It is not superseding. It is the last one. Okay, and what about option C? Interviews must outline everything that occurred at least 1 month prior to collection. Interviews must outline, it is correct. At least 1 month prior to collection, it is correct. But what about everything that has occurred? No. Okay, so everything that has occurred, not mentioned anywhere. They should know about medical and social history. Not everything that has occurred. Okay, so that you can eliminate option C. Again, it is contradictory or opposite option. So whether you like it or not, my answer is option A. Okay. Collection can only take place once their history has been taken. That is the correct answer. Clear? Any doubts? Okay. So you are wrong, right? Okay. Okay, so it's okay, dear. Okay, so okay, Varsha, it's option A. Sankita, yes. Shiny, very good. Yes, it is option A. So any doubts in this question? No doubts, right? Okay, so let's move to part A. Okay, so here we have another new topic, which is cyanosis. Okay, Roshna. Yes, cyanosis. So how is this material? It was not that much difficult, like I said on the previous day, but it was average, not that much easy. It was an average material, right? Okay. So I'll read the paragraph, then we will discuss about part A in detail today. Okay, so before that, I'll explain what strategy we are going to apply here. Okay, we will use strategy use So the strategy that's called skimming and scanning method. And you guys know what is skimming and scanning, right? Okay, so let me know in the comment box what is skimming and scanning. Then we will read and underline the important words. Okay, so what is skimming and scanning? The strategy that's called skimming and scanning. Skimming, which means fast reading or quick reading, whereas scanning, which means we are searching for some important details or important words here so that you can underline important words. Okay, that's skimming and scanning. Okay. Okay, so what are the important words that you will underline? We will write important words. Okay, so how you guys know that? These are the important words when you read each and every text. How will you know that? Okay, so for that I'll give you some strategies. Okay, so the first one, you can underline all the headings. Okay, and then you can underline all the subheadings. So heading, subheadings, all the numbers. So whatever numbers mentioned here or the figures mentioned, you can mark all the numbers. Then all the signs and symbols. For example, if the percentage is mentioned, please mark the percentage, less than, equal to, greater than. So whatever signs and symbols mentioned, mark all the signs and symbols. Then all the names, maybe name of a person, name of a disease condition, name of a procedure, name of a country. So whatever names mentioned, mark all the names. All right. Then abbreviations. Abbreviation, which means short forms. Okay, if any short forms mentioned anywhere in the text, mark all the short forms. Okay, and all the brackets. Okay, so whatever messages or whatever words mentioned inside the bracket, you guys can mark all the brackets. Okay, then all the italicized and bold words, it is very important. Then the next one, the words which indicate time. Okay, for example, now, currently, presently, after, before. Okay, so the words indicate time. Then the words can connect with experiment related words like observation, absorption, clinic, okay, identification, diagnosis, ascertain. So likewise, you can mark all the words that can relate with experiment. Then the words can be connected with research related words. Okay, research, researcher, strategy, aspect, level, population, study, group. Okay, like those words. Then the first and last line of each and every paragraph, because they will ask a lot of questions from the first and last line for sure. Okay, as well as all the bullet points mentioned. Okay, so bullet points mentioned, but whatever bullet points mentioned here, you can mark all the bullet points. Okay, and read it very carefully. That's all about underlining the keywords. So coming back to this text, so please let me know in the comment box what are your keywords from text A. Okay, so please let me know what are your keywords from text A. Yes. So what are the keywords from text A? I'll wait, I'll read, then you can type here your answers, your keywords from the text. Okay, so cyanosis is a medical term. When your skin, lips or nails turn blue due to lack of oxygen in your blood. If you have darker skin, cyanosis may be easier to see in your lips, gums, nails, around your eyes. The word cyanosis comes from the word cyan. Cyan is a blue-green color. Okay? Then normally, red blood cells carry oxygen to the tissues in your body. Your blood is red when it filled with oxygen because your blood cells are bright red. As a result, when oxygen-filled blood circulates throughout your body, your skin has a pink or red tone. When there is not enough oxygen circulating in your blood, it is darker and more of a blue or purple tone. The area of your body that is most affected by cyanosis can help determine the cause. The three types of cyanosis are circumoral or perioral, then peripheral and central. So these are my keywords from text A. So what about you guys? Let me know in the comment box what are your keywords so that I can correct you. Okay. Okay, Shiny, brackets, all headings, subheading, numbers, signs and symbols, all names, abbreviations, bold words, time, research. Okay, dear. So let me know what are your keywords from the text A. Okay, a lot of keywords here. Even though it is a very small text, we have so many keywords here. Oru cheriya text aanengilum, yeah, a lot of keywords. Okay, so please let me know what are your keywords from text A. Yes, I hope you guys are typing. Okay, so I'll read text B, then please let me know about A and B. So diagnosis. So we have a heading. It's all about the identification or diagnosis of the condition. Then check oxygen saturation via pulse oximetry. So oxygen saturation pulse oximetry. If it is low or normal, then you can check arterial oxygenation. Okay. Then if it is low or normal, then oxygenate. Plus what? Check methemoglobin level. Okay. Then what else? If it is high or normal, if it is high, obtain history of a drug toxin exposure that could cause methemoglobinemia. Okay. And obtain family history of cyanosis. Consider therapy with the methylene blue. Okay. Then process that affects your skin is likely obtain the history of drug and metal exposures and other medical conditions. If necessary, confirm diagnosis via skin biopsy. Okay, so that's all about my keywords. Okay, yes, Reshma, very good dear. Cyanosis, blue, oxygen, cyanosis, blue, green colored blood cells, pink or red tone, purple, circumoral, perioral. Very good, excellent dear. And I think you have marked. Yeah, determine is an important word. Okay, Reshma, you can also mark determine. That is a word that indicate what? Experiment, identify. Okay. Yes, so what about others? Okay, Benny, cyanosis, blue, darker, skin, cyan, red blood cells. Darker is actually, okay, it's okay. Bright red, pink, red tone, oxygen, purple tone, 3 types, circular, perioral, all right. Okay, so what about others? Any other keywords other than this? No. Okay, so now I am just moving to text C, symptoms. It's all about the symptoms. Infants with cyanosis get tired of sweat while feeding and show lack of weight gain. Then they may be born with a low birth weight. They may be irritable and often feel floppy or limp. There is flaring of the nostrils as evidence of labored breathing. Some babies may grunt or emit a noise with each breath. There may be breathlessness, difficulty breathing and rapid shallow breathing. This may happen suddenly in cases of pulmonary emboli, pulmonary edema or severe asthma. Other symptoms include chest pain if cyanosis is caused due to pleural effusion or collection of the fluids around lungs. Pneumonia or pulmonary embolism, there may be chest pain. Pulmonary edema also causes dull, aching chest tightness. There is accompanying fever in patients with pneumonia or pulmonary emboli. Those with heart failure may also cough up a pink, frothy sputum and dark mucus. Okay, so that's all about my keywords from text C. Okay, so now text D, it's all about the treatments. Okay, so what about the treatment? One of the first treatment is what? Your healthcare provider may use is oxygen therapy. Okay? Oxygen therapy provides you with extra oxygen to help boost your levels quickly. You may need a breathing machine or ventilator depending on your severity of your condition. Other possible treatments include warmth and massage. Exposure to cold temperatures and conditions such as Raynaud's phenomenon may be treated with warming and massaging the affected areas. Then antibiotics can treat infections such as pneumonia. Other medications, your healthcare provider may prescribe medications to treat heart and lung conditions. Then discontinuing medications, certain medications here. Your healthcare provider may recommend you to stop taking certain medications. Then inhalers will be there, like if it is asthma, then you can go with some inhalers. Okay. And about surgery, congenital heart defects such as tetralogy or Fallot's may need surgery soon after birth. So that's all about the keywords. Okay. Yes, Jobin, flaring, breathlessness, chest pain, pulmonary edema. All right, dear. So I'm moving to the first question. So let me know in the comment box what is your answer for the first one. Yes, I'll wait. First question. The inceptive management option admonished by healthcare provider to mitigate the condition. Okay. Any other answers other than C and D? So my keywords, inceptive, then admonished, mitigate. Okay, so these are my keywords from the question. Okay, yes, Shiny, Benny, Reshma. Okay, Saji. So why it is text D? Is it because of the management? I hope it is because of the management, right? Yeah. Okay. So even though these words are difficult, inceptive, admonished, mitigate. So mitigate, yeah, that you know, it means elimination or avoiding. Inceptive, that means initial, the beginning. Okay, that means inceptive. So the initial management option admonished by, admonished which means if you are advising someone, that means admonishing. Okay, so that means the inceptive, the initial management option advised by the healthcare provider to avoid the condition. Okay, so these keywords, of course, it is mentioned in text D. It's all about the management. Okay, your healthcare provider. Okay, so what is the initial treatment? The first treatment. So that means answer is D. Okay. Yes. Okay, Shani, it's management. Yes, Reshma. Okay, so what about the second question? Why does the completion, it's not completion actually, there is a small spelling error here. COMPLEXITION, completion. Okay, it is completion but it is complexion. Okay, so why does the complexion of the skin appear light pink? So complexion which means the color. Okay, the color of your skin. So why does the color of the skin appear light pink? So where is it mentioned about the color? Light pink, skin. Okay, so where is it mentioned? Of course, yeah, it's mentioned in A. So answer is text A. As you can see here, I'll show you the answer. Yes. Okay, so which is mentioned in here, second paragraph. As a result, when oxygen-filled blood circulates throughout your body, your skin has a pink or red tone. Okay, that means it's A. That's from A. Third one, the condition cognate with cyanosis, that has to be mended with a surgical intervention. Again, I know that you have no idea what is the meaning of the word cognates. Okay, as well as mended. So, even though these two words mentioned, we have another keywords there. So, condition, surgical intervention. So, where they've mentioned about these surgical interventions here? Okay. Yes, Shiny and Jobin. Yes, it's D. Okay, it is from text D. Cognate, which means associate, connect, relate. Okay, mended, which means what? Mended, which means what can I say? What can I say? Restore, restoring something. So that is mended. Okay, so the condition associated with cyanosis that has to be restored with a medical intervention. Oh, sorry, surgical intervention. And the word is mentioned here in text D, surgery. Okay, a surgical intervention. So, of course, that's from D. Then the fourth one, how does the conception of the designation of the condition occur? So, designation, you know, it's about the name. Okay, conception, which means the meaning, or you can say the beginning, the initial of the word. So, where is the source of the word? That originating, the meaning. Okay, that is designation of the condition. That means cyanosis. Where is it mentioned? Okay, Linu, hi. Okay, yes, Sankita, healthcare provider, yeah, it's mentioned there. Okay, Shiny, yes, Shiji, answer is A. Okay, so D-A, yeah. So answer is A, and where is it mentioned about the designation of the name? So that's from here. The word cyanosis comes from the word sign. Okay, which means blue-green color. So that is A. Then fifth one, common signs of cyanosis noted in newborns. Common signs, newborns. So where is signs and symptoms mentioned? Yes, symptoms mentioned in C. Infants with cyanosis. So that means it is from C. Yes, Reshma. Yes, Shiny, Saji. Okay, Benny. It was A. Yes, Reshma, we are. Yes, Benny, it is C. Okay, and what about sixth one? The succeeding step to be taken if the arterial oxygenation seems to be very low. Okay, not very low. It's low. So succeeding arterial oxygenation. Oxygenation is a word which I found somewhere in the pictorial, right? Okay. So where is it mentioned? Sixth question. Okay, Lino, yes, Divi. Fourth one is A. Then fifth one C. What about sixth one? Sixth question. Question number 6. Question number 6. Oxygenation. And that's mentioned in this pictorial, I guess. Okay, see, check arterial oxygenation. So, this word is only mentioned in text B, I guess. Yeah. So, that's from B. Yes, Reshma, very good, dear. Yes, Bindu Thomas, it's from B. And the 7th one, final one, what all conditions are characterized by the onset of chest pain or breathlessness in patients? Okay, so conditions characterized breathlessness, or you can mark chest pain. So I'll go with chest pain. Yeah. So what all conditions characterized by onset of, so that means onset, beginning of chest pain and breathlessness, those are symptoms, right? Yeah. So those are symptoms. There may be breathlessness, difficulty breathing. Yeah. Okay. So I found here, that's from C. Okay. Yes, Reshma. Jobin, Shiny, Sankita. Yes. Correct answer. Okay. So now we are jumping to the next set of questions, which is 8 to 14 short answer questions. What is important? You can write it in a word or a short phrase. Maximum 3. So the first one, therapy with which component has to be administered if the methemoglobin level is higher. So my keywords: therapy, component, methemoglobin. Yeah. So what therapy? Any idea? Therapy with which component? Sorry, not therapy, with which component? Yes. Okay, Shiny. A lot of correct answers. Good. Okay, Shiny. Yes, Reshma. 7 out of 7. Excellent. Okay, so what about eighth one? Eighth one is methylene blue. Okay, methylene blue. Where is it mentioned that's methylene blue? Okay, and I think again it's from the pictorial. Yes, see, consider therapy with methylene blue. Okay, so answer is methylene blue from text B. Okay, so that's from the last box here. Answer is methylene blue here. Okay, yes. Thank you so much for the active participation. Yes, Anu, Roshna, Reshma, Jobin, Star, Delighta, Joshna, John, Saji, Jacob, Divi. Yes, it is methylene blue. Very good. Ninth one. What does cyan indicate? What is cyan? Without even reading. Yeah. So what is cyan? Yes, yes. What is cyan? Cyan, which means, yeah, it is mentioned in text A, I guess. Cyan is a blue-green color. So answer should be blue-green color. Okay, that hyphen should be there because this is a hyphenated word. So hyphens should be there. So blue-green color. Okay, yes, yes, Shiny, Akku, Reshma, it is blue-green color. All right. Okay, it is mentioned in not text B, it is text A, right? Yeah. Okay, Devi, about 8th question, right? Yes. Okay, Anu, yes, Saji, Jacob, yes, Delighta, yes, blue-green color. Okay, Shiny. We should write A or not. Let me check one second. You can write a blue-green color. Okay, because article is not mentioned anywhere in the question, so you should write article there. So, a blue-green color. Okay, 10th one. The utilization of which technique is done to measure oxygen saturation? So my keywords: utilization, technique, saturation. Okay, so any idea? 10th one. The utilization of which technique is done to measure oxygen saturation? Which technique? What technique is mentioned here? Yes. Article not mentioned, right? Once again, if the article not mentioned, you don't have to write here. Once again, let me check. Okay. Here article is mentioned. Cyan is a blue-green color, so that you can write a blue, then a green color. Okay. Yeah. So what about that question? 10th one. Which technique? Utilization of which technique? Oxygen saturation. So that means techniques mentioned in this box. So I think check oxygen saturation through or via pulse oximetry. So answer is pulse oximetry. Yes. Okay, Reshma. Yes, Reshma, it is pulse oximetry. Okay. Yes. So what about the next question? 11th one. Which medication would be good enough to treat infections like pneumonia? Okay, so which medication, not medication, medications, plural, okay? Good enough to treat infections like pneumonia. So let me know which medications, any medications mentioned here? So please let me know which medication, 8th medication, Anna. Okay, Linu, methylene blue. Is it a medication? Yeah, but infections like pneumonia, to treat pneumonia, what medication is mentioned? I think it is in text D, right? In the treatment options. So what medication to treat pneumonia infections? See, antibiotics. Antibiotics can treat infections such as pneumonia. So answer is antibiotics. Okay, so answer should be antibiotics from text D. Then 12th one, the deficiency of which element in the blood causes cyanosis? So some element is lacking there, deficiency, lack of which element? Okay, which element in the blood causes cyanosis? ഏത് എലമെൻറ്റിൻ്റെ ലാക്കിംഗ് ആണ്, ഡെഫിഷ്യൻസി ആണ്. The deficiency of which element in the blood causes cyanosis? So which element? Which element? Okay, so the deficiency of that element that is in text A. Okay, so lack of, deficiency of oxygen in your blood. So that element is oxygen. Okay, so answer is oxygen. Then 13th one, the prolonged activity that precedes flaring in the nostrils. So prolonged precedes nostrils. The prolonged activity of flaring in the nostrils. 13th one. So what about that one? 13th question. Very good. Yes, Shiny, it's labored breathing. Yes, it is mentioned in text C, one of the symptoms. So, and that's mentioned in the third paragraph here. There may be breathlessness, difficulty breathing, and rapid shallow breathing. Then, so yeah, in the previous line, there is flaring of the nostrils as an evidence of labored breathing. So yeah, so that's here. Okay, labored breathing. So answer is labored breathing. Then 14th one, what may help to improve the working of the lungs in the affected have conditions such as asthma or COPD? Asthma, COPD, and improve. Okay, so these are my keywords. So what will help? Very easy question. Okay, so what can help? What can help? It's a inhalers. Okay, yes. Okay, Benny, Jobin, Roshna, Saji, yes, it is, yes, Devi, it is labored breathing. And what about the last one, 14th one? It is inhalers. Okay. Then the last set of questions, 15 to 20, fill in the blanks. First one, let me know in the comment box what is your answer for the question number 15. We could observe coughing up a pink frothy sputum, dark mucus by patients with dash in association with cyanosis. Yes, yes, Saji, it is inhalers. Okay, Reshma, we are inhalers. Okay, so 15th one. What about 15th one? Yeah, so that is heart failure. Okay, so where they've mentioned about heart failure in the text? It's from text C. Okay, heart failure. So what was the question? Yes, those with heart failure may also cough up a pink frothy sputum and dark mucus. Okay, so that means heart failure. Answer is heart failure. 16th one, your blood is red when it is filled with oxygen because of your dash are bright red. So what is bright red? Connected to blood, I guess. Yeah, of course. So that's from text A. Okay, so your blood is red when it is filled with oxygen, that is the question, because your blood cells are bright red. So what is the correct answer? Blood cells. Okay, answer is blood cells. Yes, Jobin, yes, Jinsa, yes, it was heart failure for 15th question. Okay, Reshma, Benny, yes, okay. And 17th question, exposure to cold temperatures and conditions such as dash may be treated with warning and massaging the affected areas. Okay, so what is dash? Suggests what? Yes, okay, Shani, very good. Answer is Raynaud's phenomenon. That's from D. Okay, warmth and massage, exposure to cold temperatures and conditions such as Raynaud's phenomenon may be treated with warning and massaging the affected area. So answer is Raynaud's phenomenon. Okay, then 18th one. Once the level of methemoglobin finds high, then obtain history of drug or toxin exposure that could cause dash. It could cause what? Methemoglobinemia, right? Yeah, so that's from text B, here is the answer. Okay, exposure, toxin, history, drug. Okay, so answer is methemoglobinemia from text B. Okay, and second last one, 19th one. There may be dash if cyanosis is caused due to pleural effusion, pneumonia or pulmonary embolism. So what is that? What is that? Yes, Benny, correct answer. Yes, Anu, Star Delita. Yes, Reshma, Akku, Shiny, Bindu. Yes, yes. Okay, Roshna, it is Raynaud's phenomenon. And what about 19th one? Answer is chest pain. One of the symptoms from text C. Okay, other symptoms include chest pain. If cyanosis is caused due to pleural effusion, yeah, so there is a chance for chest pain. Okay, answer is chest pain. Yes, yes, Akku, chest pain. So what about the last question, 20? Question number 20. If you have dash, cyanosis may be easier to see in patients in your, see in your lips, gums, nails and around your eyes. Okay, so if you have a what? If you have a darker skin. Okay, see, if you have a darker skin, then it will be very visible. Okay, so answer is darker skin. Clear? So any doubts regarding any of the questions here? Anyone with 20 out of 20? Okay, Shiny, 19, excellent, very good. Then anyone with 20 out of 20? Reshma, it is not dark skin, dear, darker skin, okay? Yeah. Yes, Saji, not dark skin, darker skin, okay? Yes, Star, very good, excellent, 20. Yes, Jinsa, 20 out of 20. Anyone else with 20 out of 20? Okay, Akku, excellent, dear. Okay, Reshma, it's okay, 19, very good. Okay, so that's all about that. Okay, so see you tomorrow. Take care. Thank you.